Welcome to the Marijuana and the Developing Brain presentation. My name is Kitana Martinez-Dolly. I received my bachelor's degree in neuroscience from Dartmouth College, and I am a graduate student in public health at Brigham Young University. This presentation was made in collaboration with Dr. Deborah Gaidosh, a public health nurse at the Mat-Su Public Health Center. Since Alaska legalized recreational marijuana use in 2015 for individuals 21 years of age or older, it has raised a lot of questions from health providers and community members about the health effects and safety of the drug. Particularly important is the need to understand the impacts of marijuana on the developing brain, as an increasing amount of adolescents have access to marijuana. This presentation will inform about the latest research demonstrating the detrimental effects of marijuana on developing brains. The presentation will also provide information about other topics related to marijuana that community members should be aware of, such as the impacts of marijuana on pets and developing fetuses, and the dangers of edible marijuana and synthetic marijuana, also known as spice or K2. There are a number of learning objectives for this presentation. By the end, you will be able to explain the impacts of THC on the developing brain and understand how it manifests itself through cognitive and physical impairments. You will be able to educate others about the dangers of edibles and synthetic marijuana, as well as the dangers of marijuana on babies and pets. But most importantly, you will understand your role as a public health nurse and how you can act within your community to educate about the effects of marijuana on the developing brain. The quote here on this slide really embodies the goal of this presentation, though. When you open your mind, you open new doors to new possibilities for yourself and new opportunities to help others. So as we learn about the effects of marijuana on the brain, we'll be able to better understand for ourselves the impacts of marijuana and be able to take that information to help empower others and educate others about the detrimental effects. And ultimately, this will help to really make a difference within the community. Here's a little bit of information about marijuana or cannabis. Some of the street names may refer to marijuana as pot, weed, herb, grass, bud, ganja, or Mary Jane. Marijuana comes from the hemp plants Cannabis sativa or Cannabis indica. There are over 400 chemical compounds present within marijuana, and the main psychoactive chemical compound is tetrahydrocannabinol or THC. What most individuals don't realize is that the THC content within marijuana has increased dramatically over the past few decades. In the 1990s, marijuana samples indicated that the THC content was 3.7%. Samples from 2014, however, showed that the THC content increased to 6.1%. And this dramatic increase in THC may be responsible for the detrimental effects that marijuana has on developing brains. So it's important that individuals understand that the marijuana of today is not the same marijuana that was present in the 1970s, 80s, and 90s. It's much more potent with a higher THC content. Some of the short-term effects of marijuana may include pleasant euphoria, relaxation, and heightened sensory perception. While these are the desired effects that marijuana users may seek for, there are also a number of negative short-term effects. These negative effects may include panic and anxiety, occasional hallucinations and delusions with high doses, impairments in short-term memory, attention, and learning, impaired concentration and hand-eye coordination, lethargy, increased heart rate, slowed reaction time, sleep disturbances, and increased appetite. It's always interesting to ask individuals what they've heard about the medical uses of marijuana. While there's a lot of information out there about potential medical uses, research shows that there are only a handful of medical conditions that THC or marijuana may be beneficial for. These include chronic pain disorders, chemotherapy-induced nausea and vomiting, as well as stimulating appetite in AIDS patients. Medical marijuana may also be great at improving spasticity symptoms associated with multiple sclerosis. Research indicates, however, that marijuana is not effective at alleviating epileptic seizures, Tourette's syndrome tic severity, and movement disorders in Parkinson's and Huntington's disease. So, while there are a handful of medical uses that the drug has proven beneficial for and safe for, there are also a number of other medical conditions that do not have enough research supporting their effectiveness and safety yet. When we refer to medical uses of marijuana, it's also really important that individuals understand that medical marijuana comes in isolated forms. You can get isolated THC pills that have been able to extract the compound and put it in an isolated form. That way, individuals are not exposed to the hundreds of other chemical compounds within marijuana. So as we educate others about the medical uses of marijuana and the impacts that marijuana has, it's important that individuals recognize that it's not safe to self-medicate using marijuana because of the hundreds of other chemical compounds present within marijuana. Over time, I believe we will see a lot of research looking into these various chemical compounds and how they work in certain combinations to create valuable medical uses for the drug. However, at this current time, there's not enough information out there to understand the exact number of medical problems that can be solved using medical marijuana. It's important that public health professionals are also aware of the rates of adolescent marijuana use in Alaska. The Alaska Department of Health and Social Services reported from the 2015 Monitoring the Future survey that 15% of white high school students and 26% of Alaska Native high school students used marijuana at least once in the 30 days prior to the survey. This statistic was much higher for the population that's 18 to 25 years old. 35% of 18 to 25-year-olds used marijuana in the 30 days prior to the survey. This is important because the brain is still developing until 26 years old. So it's important that we not only educate high school-aged students, but also the young adult population, 18 to 25, so that they're aware of the impacts that marijuana can have on their developing brain. Another statistic to be aware of is that 38.8% of high school students, grades 9 through 12, reported ever using marijuana. With the increased access of marijuana and use within Alaska, the perception is that there's not much of a danger. We've seen that this perceived risk has decreased over the past few years. A survey that looked at the perceived risk of smoking marijuana at least once per month, 26% of adolescents grade 9 through 12 reported in 2009 that they thought there was a risk of smoking marijuana once per month. But in 2014, when adolescents were surveyed, only 19% reported there to be a risk with smoking marijuana once per month. Although statistics are not available for the present day yet, since the legalization in 2015, there's reason to believe that this statistic will continue to decrease, that less adolescents will perceive there to be a risk about smoking marijuana once per month. Before we take a closer look at the impacts of THC on the brain, it's important that we have a basic foundation of neuroscience understanding. Within our brain, there are 85 to 86 billion neurons. Neurons are the building block of communication. They receive signals and send signals to other neurons to create a network of communication. A phrase we use in neuroscience is neurons that fire together, wire together. So as neurons create this network of communication, they help the brain to carry out all of its functions. When a neuron receives a signal, it sends another signal to a neuron nearby using neurotransmitters, or very small chemicals. And these chemicals are received by receptors on the next neuron. A couple of neurotransmitters and receptors that will be a focus for the presentation today are endocannabinoids, which is the neurotransmitter system that THC affects, as well as dopamine. And dopamine is really important for reward and motivation. And we will see this play a particular impact on drug abuse and addiction. Two other neurotransmitters important to understand are GABA and glutamate. GABA is the neurotransmitter that inhibits a signal going from one neuron to another. So when a neuron releases GABA and it's received by the next neuron, it shuts down that communication. Glutamate, conversely, is excitatory. So when glutamate is sent from one neuron to the next neuron, it excites that neuron and continues to send the signal to the remaining neurons within that network. The receptor that's important for this presentation is the CB1 receptor, which is the receptor that THC binds to interrupt this neuron communication. Here we can see the developing human brain through time. The frontal lobe is really important for executive functions, so all of our decision making, our emotional control, our impulsivity control. The frontal part of the brain really controls these aspects of cognition and executive functions. So we can see here in this image that the frontal part of the brain is the area that is continuing to grow most dramatically over the lifespan. THC acts in the brain because its structure is similar to a natural chemical in the brain called anandamide. When THC binds to CB1 receptors, it really disrupts the normal neuron communication. So by mimicking anandamide, by taking anandamide space within the CB1 receptor, it creates a number of neurological changes that we will look at here in the following slides. We can also see here that the CB1 receptors are located throughout the body. So THC does not only impact the brain, but has a number of other physiological impacts as well. If you're interested in taking a closer look at exactly how THC acts within the brain, you can visit this YouTube website. The video will show an animation of THC binding to CB1 receptors and taking the place of anandamide. And as THC binds to CB1 receptors, it really disrupts the normal neuronal communication and networks that are present within the brain. And you can take a closer look at this using the YouTube web address provided here. Here we take a closer look at the brain areas most impacted by marijuana. CB1 receptors are most highly concentrated in the prefrontal cortex, the hippocampus, the basal ganglia, the cerebellum, and the ventral striatum, which includes the nucleus accumbens. All of these areas are highlighted within the image, and the regular function that that brain area helps to control is also listed here. So let's take a closer look now at each of these areas and how marijuana impacts these brain areas to cause cognitive and physical impairment. The first area that we'll look at is the prefrontal cerebral cortex. This area is important for controlling all of our executive functions, which include our ability to make decisions, to regulate emotions, and to control behavioral responses. Studies show that adolescents who met the DSM criteria for cannabis abuse had smaller right medial orbital prefrontal cortex volume. And the severity of brain volume abnormalities is proportionate to the amount of marijuana consumed. In addition to these structural differences present among adolescent marijuana users, studies also indicate that there are less connections present within the brains of marijuana users. So, neuron connections and this network of neuron communication, they are self-destructing, leading to less connections and less communication within the prefrontal cortex, which will affect the brain's ability to make decisions and to learn. Additional studies also reveal that adolescent marijuana users' brains have more activation in the frontal lobe. And this image here indicates in blue the areas of the brain where there's more activation in marijuana users compared to non-users during cognitive tasks. This increased activation may be associated with Alzheimer's and dementia in the future after an individual grows older, but longitudinal studies will need to continue so that we can understand the long-term impacts of this increased activation. But if we think about it in relationship to a car, the faster and more resources that a car uses, the sooner it dies off. This may be analogous to the brain. The more resources and activation that the brain uses, the sooner it could die off as well. These structural and connectivity differences present among marijuana users compared to non-users manifest themselves through long-term impacts. Studies have shown that adolescent marijuana users have decreased attention, have worse impulse control and executive function, worse decision making, aren't as able to learn, and have worse processing speed, especially when an adolescent uses marijuana at least 5 times per week. A longitudinal study over 38 years in New Zealand also discovered that persistent cannabis use over 20 years was related to a decline in intelligence, and the greatest decline in cognitive performance was present among individuals with weekly cannabis use before age 18. Adolescents who used marijuana at least 4 days per week led to an IQ drop up to 8 points. But those who did not use marijuana had no average change in IQ points. IQ points were not recovered after quitting marijuana use. This study really shows the impacts that marijuana can have on the developing brain, but it's also important to look at scientific studies with an analytical eye to maybe understand some of the other factors that can contribute to the decline in IQ. Some of these factors may include socioeconomic status, education, trauma during life, and a number of other things that we look at in public health that may influence health. Adolescent marijuana users also have worse educational outcomes. Studies indicate that marijuana users have lower grades by an average of 1 grade point below their peers who don't use marijuana. They have lower standardized exam scores, and they have a less likelihood to graduate from high school and attend college. The next brain area we'll look at is the hippocampus, which in the image on the bottom left is highlighted in red. The hippocampus is very important for memory and cognition. Studies have also indicated, as we saw with the structural differences present within the prefrontal cortex, that adolescent marijuana users also experience smaller brain volumes than individuals who do not use marijuana, and the severity was proportionate to the amount of marijuana consumed. Adolescents who met the DSM criteria for cannabis abuse also had worse memory. So individuals who used marijuana at least 5 times per week have shown to have worse short-term and long-term memory recall. The basal ganglia and cerebellum are very important for controlling movement and coordination, and these brain areas particularly impact an individual's ability to drive while under the influence of the drug. When an individual is under the influence of marijuana, it's difficult for them to judge time and distances, road sounds, traffic signals, and changing conditions of the road. Data indicate that individuals who drive while under the influence of marijuana have a 2 times increased risk of getting in a car crash and are 2 times as likely to get a traffic ticket. When looking at high school marijuana users specifically, data reveals that that these users are 65% more likely to get in a car accident. A 2016 study found that 10% of high school seniors reported driving after using marijuana in the 2 months prior to the survey. So this may be an area of educational outreach that could particularly impact a community, to educate high school students about the dangers of driving while under the influence of marijuana. When an individual is suspected of a marijuana-related DUI, police officers can implement a field test to assess the movement and coordination and reaction time of the driver. If they suspect that the individual may be under the influence of marijuana, then they can take them into the police custody, and they then have to either receive a warrant or get consent to do a blood test to measure the amount of marijuana in their blood. Because of the challenges associated with this testing, there have been a number of emerging technologies that are currently being tested to see how they can better determine marijuana-related DUIs in a faster time frame and without as many hoops to jump through legally. The THC saliva test is one of these emerging technologies. A challenge with this saliva test, however, is that it can detect marijuana use from 3 days before the test. So this is better than a urine test, which detects 21 days before testing, but there could be a lot of legal ramifications to using THC saliva test technology to determine marijuana-related DUIs. But as technologies continue to develop, there may be new ways emerging to better determine marijuana-related DUIs. The ventral striatum, which includes the nucleus accumbens, is a brain area very impacted by marijuana use as it relates to abuse and addiction. The ventral striatum is the center or home of the reward system. One of the short-term effects that we discussed at the beginning of the presentation is that marijuana can cause euphoria and relaxation. This is because when THC acts on the brain, it causes the ventral striatum to release dopamine. Dopamine is the neurotransmitter that creates this euphoria and relaxed feeling. Dopamine is also the neurotransmitter, though, that is responsible for abuse and addiction. And we'll see in the next slide the impacts that dopamine has on the brain, the irreversible impacts that dopamine creates. But a few statistics first is that 1 in 10 marijuana users becomes addicted to the drug. Not all these individuals who become addicted seek treatment, but the National Institute on Drug Abuse does indicate that 1 in 10 users becomes addicted. And if an individual begins using marijuana before age 18, this risk of abuse and addiction changes to 1 in 6. So there's a much higher risk of becoming addicted to marijuana if the individual begins using before age 18. The risk of addiction and abuse also increases with daily use. Statistics indicate that 25 to 50% of daily marijuana users become addicted. So some of the brain changes that occur with addiction, especially related to the ventral striatum and the reward system in the brain, is that the number of dopamine D2 receptors decreases. And this image on the left really shows those changes in dopamine receptors. I was not able to find an image showing the changes in marijuana, but studies do indicate that all drugs of abuse impact the brain in this way. That as an individual uses the drug, the brain self-destructs the dopamine receptors so that there aren't as many there to be flooded by the increased dopamine that's present within the brain after using the drug. So these decreased dopamine D2 receptors is responsible for reducing natural highs. Individuals who become addicted to the drug often experience a decreased affect. They may experience mild depression and anxiety and have a more difficult time experiencing natural highs, because when they do a naturally rewarding thing such as eating food or exercising, there's not these receptors that would normally be there for the dopamine to bind to and create that euphoric effect. And these changes in dopamine receptors have shown to be irreversible and long-term. They may also contribute to drug tolerance, so it takes more of the drug to get the same desired effect, which may lead actually to individuals using other drugs. So this is where the gateway drug theory comes in. So while most individuals who use marijuana do not go on to use other drugs, individuals who do report using other drugs report that they first used marijuana. Animal studies also indicate that THC heightens the response of other drugs, making these other drugs more pleasurable to the brain. In addition to the dopamine receptors that change and this impact that it has on drug tolerance and natural highs and using gateway drugs, the sensitivity and number of CB1 receptors is also impacted. So CB1 receptors may also decrease, and they may not work as well when a THC molecule binds to it, or even when a natural chemical such as an anandamide binds to the CB1 receptors. So these brain changes together are responsible for addiction. They are irreversible, which is why individuals oftentimes relapse after treatment, because their brain is not really able to fully recover. These brain changes are really important for individuals to understand that it's not just the short-term impact, but these long-term impacts as well are very important to recognize and for people to understand. In addition to the brain changes that occur with marijuana use, there are a number of other physical impacts. Some of these include breathing problems. With chronic cough and bronchitis, the image on the right shows a lung of an individual who was a marijuana user starting in adolescence. So we can see the tar buildup. Because there are 400 or more chemical compounds within marijuana, it can really impact the lungs and our ability to breathe. Studies have also shown that marijuana impairs blood vessel function. Animal studies have found that rats exposed to 30 minutes of marijuana experience a drop in blood vessel function by 70%. So if we see on the image on the bottom right, there's a blockage in a blood vessel. When blood vessels get blocked, it can cause heart attack and stroke. Correlation studies have shown that adolescent marijuana users have a 26% increased risk of heart attack and a 10% increased risk of stroke. And it may be related to the impaired blood vessel function that has been shown in animal studies. What are some of the dangers and ethics you think about when you see these photos? I know for me, I am astonished by just how similar the packaging of the candies in the top right appear to normal candies that are not infused with marijuana. Instead of being a Butterfinger, the edible marijuana products may be referred to as Butterfinger, or instead of Oreo, they refer to them as Oreo. The packaging looks very similar, very appealing, and it's very dangerous for children and pets who may accidentally consume these products. Same thing with the pictures in the bottom part of the slide with the lollipops and the cakes. They're not well labeled, so individuals are not aware of the THC content within each of these products. Edible marijuana products pass through the digestive system. They have a delayed effect, so it can take about 30 minutes to 3 hours to experience the marijuana effects. They have longer lasting effects, but because of the delayed effect, individuals may not recognize that they are high or under the influence of marijuana. So they keep consuming these tasty treats, not being aware of the amount of THC that they're consuming. A lot of these products, especially if homemade, it's also difficult to control the THC content. You're not really aware of how much THC content is present within these treats when you make them at home or when you buy them from another individual who made them at home. This can lead to a greater risk of THC poisoning, especially when ingested by children and pets. So it's important that public health professionals and legislators are aware of these impacts of edible marijuana products so that they can create different intervention plans to control the packaging and to educate about the risk of THC poisoning due to the delayed effect and the difficulty to control THC content present within the treats. Synthetic marijuana is a new emerging drug referred to as K2 and spice. And these are herbal mixtures of unknown chemicals. While the chemicals are unknown and the combinations are unknown, we do know that they impact the same brain systems as marijuana. They bind to CB1 receptors, and in fact, they actually bind stronger to CB1 receptors. But because the chemicals are unknown, they have very unpredictable effects. The chemicals within K2 and spice are also always changing, because as regulations ban certain combinations of chemicals within drugs, the manufacturers of synthetic marijuana will change the chemical composition just slightly so that it's not on the banned substance list. So they're working around the regulations put on them, creating these mixtures of unknown chemicals that are always changing. Because of the changing chemicals, it can have very powerful and unpredictable effects. Some of the effects that have been reported are elevated mood and relaxation, but the negative impacts include rapid heart rate, vomiting, violent behavior, and suicidal thoughts, possibly hallucinations, anxiety, paranoia, and confusion. There have been a number of individuals who have gone to the emergency room because of these very powerful and unpredictable effects. In 2011, there were 28,531 emergency room visits in the United States that were associated with synthetic marijuana use. I was unable to find a more recent statistic that was from a credible source, but there are thousands of individuals each year who go to the emergency room because of their use of synthetic marijuana. And it's important that the community is aware of the impacts of synthetic marijuana and the dangers that it can have on the brain and body. There are a number of instances at public health centers in Alaska where pregnant patients report self-medicating pregnancy-induced nausea with marijuana. So it's important that individuals are aware of the impacts that marijuana has on the developing fetus and on little babies who are breastfeeding. Research shows that THC crosses the placenta. So when a mother uses marijuana, it crosses the placenta and decreases placental development. The inhibited placental development leads to decreased nourishment and gas exchange, and this decreased nourishment and gas exchange has been correlated to a 2.3 times increased risk of stillbirth. Data from the Alaska Department of Health and Social Services indicates that 5 to 29% of pregnant women in Alaska report using marijuana during pregnancy. And this range from 5 to 29% is stratified by education level. So about 28% or 29% of women in Alaska with less than 12 years of education reported that they used marijuana during pregnancy. Only about 5% of women with 16 or more years of education reported that they used marijuana during pregnancy. Regardless, still 5 to 29% of pregnant women in Alaska report using marijuana during pregnancy. And this can be very dangerous on not only the birth of the child, but also the long-term impacts as they grow through their life. Studies have also shown that there are about 150 of the 400 chemical compounds from marijuana that can pass to an infant when a mother breastfeeds. So the maternal use of marijuana gets passed through the breast milk to the child and can cause a number of detrimental impacts. The impacts of marijuana on babies include sedation, reduced muscular tone, and poor sucking. Studies have shown that babies that are exposed to marijuana, either through the placenta or through breast milk, have worse cognitive deficits, so they aren't as able to pay attention, they have memory problems, they aren't as able to problem solve, they have behavior problems. Maternal marijuana use may also impact the baby through an increased likelihood of hyperactivity disorders, learning deficits, and abnormal social interaction patterns. Studies have revealed as well that babies have a decreased IQ and academic performance and have worse motor development at 1 year of age. So there are a number of different negative impacts that studies have been able to show the correlation between maternal marijuana use and negative impacts on the baby. I've also included a poison control hotline number at the bottom of this slide for anyone who is interested in reporting cases where a baby has been exposed to marijuana. People may think that secondhand marijuana smoke isn't a problem. This is because marijuana smoke does not give you a contact high. There's not enough THC present within the air to make a bystander become high. An individual will also not test positive for the drug if they are around an individual who is smoking. But even though an individual may not get a contact high or a positive drug test from secondhand marijuana smoke, there are still other health problems that can emerge. Some of these health problems include breathing problems, irritants causing problems that may exacerbate asthma, and then the animal study that we referred to earlier about impairing blood vessel function also found that rats exposed to marijuana smoke experienced a drop in blood vessel function as well. So, although there's no contact high and you can't test positive for a drug test by being exposed to secondhand marijuana smoke, there are still a number of other health problems that individuals should be aware of. Pets are very important to Alaskans. There are many people who have dogs and cats that are members of their family. So it's important to understand how marijuana can impact pets when they are exposed to the drug. Dogs especially have a similar endocannabinoid system in the brain as humans. They actually have a higher concentration of the receptors, though, in their brain. So when a dog accidentally consumes marijuana, which oftentimes occurs through edible marijuana products, the dog may become lethargic, have breathing problems, experience decreased blood pressure, have abnormal heart rhythms, loss of balance, and most importantly, they experience something called marijuana toxicosis. And marijuana toxicosis is when a dog is unable to move. It stands rigidly and sways back and forth without being able to move their limbs. This is very scary for not only the pets, but the pet owners. When they love a dog so much, but they're unable to help the dog move, it can be very dangerous to the animal. And it's important that pet owners are aware of the impacts that marijuana can have on their little pet family members. Since we're public health professionals, we're all about prevention. How can we prevent adolescents, children, and pets from being exposed to marijuana and the detrimental effects that it has on the brain and body? There are a number of different prevention interventions that could occur, but a few are related to limiting access to marijuana and improving relationships and community involvement. To limit access to marijuana, we can advocate for marijuana users using closed containers and locking up their marijuana within their home. Can also advocate for decreasing the amount of personal cultivation. In Alaska right now, an individual can cultivate up to 6 marijuana plants with 3 blooming at once. This is per person. If you imagine a number of adults living in the same home, that amount of personal cultivation could create a really large access to marijuana by adolescents. So potential legislative actions could also decrease the amount of personal cultivation, perhaps limiting the number of plants per household instead of per person. But that's just one of the suggestions. There are a number of other legislative actions that you can brainstorm that can help to decrease personal cultivation. Improving relationships and community involvement is also a proven effective way to prevent adolescent substance use. A study out of Iceland found that increasing the opportunities that adolescents have to be involved in their community through extracurricular activities really created a profound impact on their community and decreased the rates of adolescent substance abuse. The study also found that improving family relationships, where families set clear expectations and follow through with them, combined with community rules and laws to set a curfew on how late adolescents can be out, really made an impact as well. And while it's uncertain the impact that some of these prevention interventions would have within communities in Alaska, they may be successful in some communities, but we don't know until we try. But there are a number of legislative actions and advocacy tools that can be used to help prevent adolescent marijuana use. And as a community, as a public health center, it is our job to brainstorm some of these actions that can be taken to prevent adolescent marijuana use. Some questions for you to ponder about your perspectives within your own community are: what are the needs that you see in your community regarding marijuana use? And what ideas do you have to help combat the public health concern of adolescent marijuana use? As you reflect on these questions and collaborate with your other community partners, you'll be able to take action within your community and to create a difference that will decrease adolescent marijuana use and preserve these developing brains that will be vital components and individuals within the community. So in conclusion, we've learned a lot about the impacts that marijuana can have on the developing brain, especially in the prefrontal cortex, the hippocampus, the basal ganglia, and cerebellum, as well as the ventral striatum as it relates to reward and addiction. We've been able to look at some of the studies showing cognitive deficits and the physical health impacts associated with adolescent marijuana use. We've discussed the dangers of maternal marijuana use during pregnancy and the impacts it has on the developing fetus and small babies. We've also been able to understand the impacts that marijuana can have on pets. So now it's time that you, as a public health nurse, take action within your community to educate about the impacts of marijuana on the developing brain. It's important that as public health professionals, we do not come across as judgmental, but that we provide information that will help our community members to be as healthy and happy as possible. There are a number of resources that were used in the making of this presentation, and I invite you to look at them more closely to understand the research demonstrating the impacts that marijuana has on the developing brain. It has been a great pleasure presenting this information to you, and I hope that you feel empowered to go out into your communities as public health professionals and health providers to educate your patients and community members about the impacts of marijuana on the developing brain, and I hope you will take action to improve the health and safety of community members in your area. Thank you very much.